We will not stop until the last drug lord, the last financier, and the last pusher have surrendered or put behind bars. Or below the ground, if they so wish.
Soon after the president took office, the PNP launched a two-pronged approach to solving the drug problem, dubbed Oplan Double Barrel, Oplan HVT to go after high-value targets or drug lords, and Oplan Tokhang for ordinary drug users and pushers. Mr. Duterte immediately bared the names of politicians, policemen, government officials, and judges accused of being drug lords or their supporters. Albuera Leyte Mayor Rolando Espinosa Sr. promptly surrendered, while his son, Kerwin, was caught after months in hiding. In November 2016, Mayor Espinosa was killed inside his detention cell. Others killed included Maguindanao Mayor Samsudin Dimaucum and suspected Iloilo drug lord Melvin Odicta and his wife. Mr. Duterte's staunchest critic, Senator Leila de Lima, was also arrested, along with her former bodyguard, Ronnie Dayan, both accused of running the bilibid illegal drug trade. According to statistics from the PNP, more than 1.3 million drug users and pushers have surrendered. More than 80,000 were arrested. More than 3,000 drug suspects were killed during drug operations. 9 drug laboratories and 150 drug dens were dismantled, including Shabu laboratories in Tarlac and Pampanga.
Merong relation yan doon sa nagiging result sa result ng crime incidents or crime environment. Mas less ang crime when we focus on the campaign against illegal drugs.
Authorities say the effect of the war on drugs could already be felt in the streets and barangays.
Para sa amin, malaki ang pagbabago. Minsan sa loob ng 1 buwan, 2 buwan, 3 buwan, wala nang hold up eh. Nabawasan yung krimen.
But others regret the number of lives lost, which could have been saved through rehabilitation.
Hindi ka na kailangan patayin o hindi ka na kailangan takutin. Ang mga yan, napabayaan sila. Kapabayaan din naman ng gobyerno yan.
Piwi is one of the drug patients currently admitted at the government's mega drug rehab center in Nueva Ecija.
Napakalaking impact ng pagre-rehab kasi marami siyang unti-unting nababago sa sarili ko.
The facility, which could house 10,000 patients, was funded by a Chinese businessman. But more than 6 months after it was built, only around 300 are currently staying here. Health Secretary Polino Bial explains only 1% of the total number of drug users need in-house treatment. That translates to 13,000 out of the 1.3 million drug surrenderers.
If the physician thinks that the patient does not need inpatient care, then it's not as if we need to fill up all the beds or all the cells.
But DOH data show only 2,500 surrenderers have so far been admitted to both outpatient and inpatient rehab centers ran by the DOH. Obial admits they have not assessed all the drug surrenderers. According to the DILG, around 100,000 are undergoing community-based rehabilitation. For a group that advocates a health-based approach to solving the drug problem, current rehabilitation efforts reflect the need to re-examine the whole premise for the government's drug policy.
We really have to weigh and evaluate if what we're doing is helpful to our, kapwa Filipino or not, or are we making things worse?
Mike Navalio, ABS-CBN News.
Bayan, huwag nyo nang hanapin ang mga pulis sa presinto sapagkat kami ay nasa inyo ng mga telepono. Dial 911, darating kami sa loob ng 5 minuto.